Good afternoon, everyone. Thank you so much for joining us for today's webinar. My name is Courtney Bettel, and I'm from the Cash Campaign of Maryland. We're really excited for you to be with us today. Just to let everyone know, we are recording this webinar, so if you miss any of the content, you'll be able to go back and review it. And if you have any questions for us, feel free to drop them in the chat box. All right, I'll turn it over to Carrie.
All right, thank you, Courtney. And thank you to everyone who's joined us today. We're going to be talking a little bit about health insurance, especially given the current situation, everything that's going on with COVID-19. Health insurance is that much more important. So we're going to be going over a couple of specific things as it relates to health insurance and how it's connected to this current situation. We're not going to be covering everything there is to know about health insurance. We're going to try and hit the highlights, just take 20 or 30 minutes. And leave some time for questions. So if I'm going through and you have questions about anything that I've said, put it in the chat. I will take a look at them once we get to the questions section, and I'll try and respond to everything that's there. So really what we're doing today is we're going to try and understand a couple of different things. So we're going to talk about why health insurance is so important, understand how to use health insurance, especially how to use health insurance right now, how to manage healthcare expenses, and how things with our healthcare expenses are a little bit different at the current moment. And then as we go through, I'm going to be identifying some of the special programs and policies and things that are out right now that are specifically related to health insurance and COVID-19. So I'm going to touch on those as we go through. So I like to start off with this just because I think health insurance is one of those things that we think like, oh, that premium comes out of my paycheck every month, or I gotta look into this and pay for it. And I think sometimes we maybe don't get a lot of time to think about why we bother paying for it in the first place. So if you have access to the chat area and you can put some things in there, why do you think you need health insurance? Why is it important to you? Why is it something that you bother to pay for? And I will wait and see if we get any responses from folks, and then I'll share some of the ideas that I have about why we might bother to pay for health insurance. So someone said, so that there's less cost when you get to the doctor, which I agree with, absolutely. It's too expensive without it, that's very true. Cheaper prescriptions, that's a huge one. I'll go through some of the things that I have here. I think that health insurance can provide some peace of mind. So it gets back to that, less cost when you go to the doctor. Hopefully it makes people feel a little bit more comfortable going to the doctor in the first place, because you can kind of think, okay, if at least I know that there's going to be some coverage if I jump through the right hoops and do the things that, I need to do. It can help protect your family's financial future. So if you've got a health insurance policy and something really crazy happens, obviously we know we're not in a whole lot of control when it comes to some of the things that happen with our health. And so it can take some of that financial stress away from it. One of the big things with health insurance policies, and one of the things that maybe gets the least attention, is health and wellness services and programs. So I always liken it to, if you have a gym membership, you pay every month to go to the gym, and hopefully you'd want to use the things that are there. You'd want to check it out and figure out, oh, is there an exercise room that I'm not taking advantage of? And I think some of the wellness services can be those things for health insurance. We're paying for it, so we want to make sure we're using all the services that are attached. And so those can be things like a health coach, regular preventive checkups, those things that health insurance is going to cover, and most of the time it's going to cover at 100%. With no cost to the person who's using it, and they can really help you stay healthy instead of trying to kind of manage things on the other end. And the last one is for better health outcomes. And I think that that's really the key. That's a lot of what we're going to be talking about today. The research tells us that people who have health insurance and use it tend to be healthier, and they tend to have better health outcomes in the long term than those who don't. And so one of the really key things with health insurance is to make sure that we're using it to maintain our health, that it's not this kind of scary thing that sits in the corner and we stress about whether or not we have to use it, but it's something that we use to take charge and to take control of our own health and well-being. So that's really, really key with our health insurance. All right. So hopefully we can all agree that health insurance is something that's really important. It's something that we need. So how do we go about getting health insurance? Most people are going to have it through some of the things that I'm listing here. About 60% of people in the US get health insurance through their employer. Other than that, there are a lot of folks who get health insurance through the health insurance marketplace. If you're in Maryland, that's Maryland Health Connection. If you're in other states, that might be the federal marketplace, the healthcare.gov. But there are lots of different websites and things that people will use, different states will use, and we'll cover that a little bit later. You might get your health insurance through your spouse's employer or your parents or your spouse's or parents' health insurance plan. So if you are under the age of 26, you get to stay on your parents' plan as long as they say that that's okay. And you can be on your spouse's plan as well. Another option for health insurance, and one of the ones that we're going to talk a little bit more about because it's coming up more for folks, is COBRA. And there are always a lot of questions about COBRA because it comes up at weird times. But usually what happens is, so to say you were to lose your job, you will usually get something in the mail that says, hey, you have access to COBRA, meaning you can keep the insurance that you have. It just changes the way that you pay for it. And that's a pretty big distinction that we're going to talk a little bit more about. And then there's federal run programs or state run programs like Medicare or Medicaid. In some places, Medicaid and the health insurance marketplace are kind of tied together. There is a slight difference, with CHIP and Medicaid and some of these other programs. But the bottom line is there are a lot of different ways to get health insurance. And with everything that's going on with COVID-19 right now, one of the major stressors for folks is what happens if I lose my job, that kind of number one option if we're getting health insurance through our employer. What happens if that drops out? Where do I go and what do I do from there? And so that's what we're going to talk about next. The bottom line is for a lot of folks, if you lose your job and that's where your health insurance coverage came from, you likely need to find new coverage. The good news is that triggers what's called a special enrollment period, or an SEP, special enrollment period. And so that means that you can sign up for a new health insurance policy. Now, normally, if you're familiar with all the technical jargon and lingo that goes along with health insurance, we have what are called open enrollment periods. So that's usually in the fall into the winter of every year. We kind of open everything up and say, hey, if you need new health insurance, if you want to switch providers, if you want to switch types of plans, if you want to switch anything, this is when you do it. The only exception to that are things called special enrollment periods, and they're usually triggered by some kind of life event. For example, if you turn 26 and then you get kicked off of your parents' plan, that's a special enrollment period. No matter when that happens to you during the year, you can switch your coverage because you kind of hit that milestone. So when we lose a job or when someone in our family loses a job, that triggers a special enrollment period, which means you don't have to wait until the fall to get signed up for different insurance. You have 60 days after you lose your job to get yourself enrolled on something new. For Marylanders, you can go to marylandhealthconnection.gov and you can kind of go through their tools there. It'll help you kind of figure out what your options are. You can also go with COBRA coverage. So this is what I was mentioning before. For folks who lose their job, you might get something in the mail that says, hey, you were getting health insurance through our health insurance coverage. Now that you separated from the employer, you have the option to enroll under COBRA. And the big difference there is that your employer will likely stop paying the section of your insurance that they used to pay. So for some folks, you might pay a couple $100s in your premiums each month, maybe more, maybe less, depends on where you live and what kind of coverage you have. But in all likelihood, if you've got insurance that's provided by your employer, they're paying maybe 50%, maybe more or less. But what happens with COBRA is that then you've got to take over paying for the section that your employer used to pay for. And that can be a really significant expense depending on what kind of plan you had through your employer. So while COBRA is great because it means that, so say, your plan was maybe a high deductible plan, but you had something happen earlier in the year and you already met your deductible. So you'd like to keep going with that plan because you've met your deductible and your insurance is going to kick in from there. You might want to pay for COBRA and keep going from there. You also might want to switch if the cost of paying the full price for your insurance that you used to get through your employer is too high. So just good to kind of know the different options that you have there. Oh, one thing that I do want to go back to here and just say really quickly is that if you were to lose your job and need to sign up for new insurance, sometimes folks think like, oh, you know, I don't have any other choice. I've got to go with COBRA. I don't have another option. Most of the time, if there's a job loss, there's a pretty significant change in the income that a family has. And so you might find that you are eligible for programs through your state, through Medicare or Medicaid, particularly Medicaid. Medicare is going to be more age and disability triggered. But you might have options to enroll in some of these other programs to get subsidies to help cover your health insurance through the marketplace. So know that kind of the whole picture has changed. So you might not have that coverage through your employer, but you might have more options for yourself as far as getting health insurance on the marketplace after a job loss. Okay, so how can you make sure that you're using your insurance? And I should say, you know, with Extension, this is a program that we've developed over the last few years, and you can kind of see the logo up in the corner. It says Smart Choice, Smart Use. We do a whole bunch of different programs for folks to help them understand health insurance a little bit better. It has crazy terminology that can be really confusing for people. So we teach 6 modules now, that are all around different health insurance topics. And actually, using health insurance is one of the full modules that we teach. So I'm going to cover some points really quickly here, but know that if this seems like it's not enough information, or if it's just kind of scratching the surface for you, we do offer more training, and I'm going to share some information about where you'll be able to find our subsequent trainings. We're going to be doing some in the month of July. So if you have more questions, don't worry. We're going to try and answer them as we go through here. Maybe not all today, but over some other webinars that we have coming up. So what are the really key points when it comes to making sure that you're using your health insurance well? The first one is really to know what your policy covers. So when you sign up for a health insurance policy, you get what's called an evidence of coverage document. And it'll be sent to you in the mail or electronically, but it's a really important document because it spells out everything that your health insurance company is agreeing to provide to you under your insurance policy. That document has all the information about what sorts of services are covered, how much they're covered, what the policies are for coverage of in-network services versus out-of-network services. And we're going to talk about that more in a second. It tells you, you know, what services require pre-authorization sometimes, but it really gives you a lot of information about under what conditions your health insurance company is going to pay and how much they're going to pay, depending on the service and the test and all sorts of different things. So knowing what your policy covers is really, really important. Having proof of insurance at all times is really important. You'll get an insurance card. Some people carry one electronically now, but having something that has all that information on there, both because when you go to the doctor, you want to be able to present that, but also because it has really important phone numbers. So if you're out and about, it might have a member services number where you can call and get information about in-network versus out-of-network doctors. So having that card with you or pictures of that card or an electronic copy, that's all really important. Choosing in-network doctors. So this is where we get into a little bit of some technological, some words, vocab kind of stuff here. So in-network versus out-of-network, it's really important to make sure we're staying in-network because you almost always get significantly higher co-insurance. Your insurance is going to pay more when you stay in-network. And really that's just a group of doctors that your insurance company has said, hey, you know, we have an agreement. We work well together, and if you go to these people, we know how much they're going to charge, and we know how much we're going to cover, and we're good there. So staying in network can be really, really helpful in terms of preventing significant expenses later. And taking advantage of preventive services. So I see a question in the chat about the COVID-19, is it considered preventative? I would love to ask you if you mean like treatment or getting tested. It can depend, but we are going to talk a little bit more about the things as it relates specifically to COVID-19, getting tested. So it's not necessarily considered preventative, but there are quite a few rules and laws that have been passed that really expand access to testing and coverage for testing. And we're going to talk about that. But yeah, preventive services are hugely important. Those are things like vaccines, well baby visits, early, getting kids their early childcare appointments, going in, getting your regular checkup. Let's see, what else might be considered? Blood pressure screenings, regular sorts of testing like colonoscopy, mammography. There's some other things that are included there. But usually there's kind of a guideline like you are a certain gender, you're a certain age, and so they're recommending that you get a preventive test. And that's usually going to be covered by your insurance if it falls in that preventive service category. And your evidence of coverage will also spell out exactly what they consider the preventive services to be. Okay. Another really important thing when it comes to using your insurance is tracking your healthcare expenses. And one of the reasons for that is because we want to be keeping track of how close you're getting to your deductible, and then making sure that you're being billed appropriately. So tracking your expenses can be really helpful for that. Okay, so this gets to the question that we had a little bit. So what about using my insurance for COVID-19? Everything we just talked about when you're using your insurance to get tested for or treated for COVID-19 is really important. So making sure you're staying in network, tracking your expenses, paying attention to bills that come in the mail, all that kind of stuff, having proof of insurance when you go to the office, all of that. On top of that, testing should be provided at no cost. There has been some, I think it was in the CARES Act, but there's been federal legislation passed that says everyone has access to coronavirus testing at no cost sharing, meaning your insurance might pay for it, but you are not going to. The key there is that there are different rules all over the place for how to get a test. So sometimes you need an order from your doctor. So you might have to actually make an appointment to be seen by your doctor so that they can order the test for you. In some places you can just walk up and say, hey, I have symptoms, or I have been near someone who tested positive, or I'm concerned because I'm taking care of an elderly relative and I'd like to be tested. It really depends on where you are. The biggest thing to keep in mind with the coronavirus testing is to stay in contact with your doctor. They can give you the best information about who is what they have to do, where you can go to get the test, all those kinds of things. So hopefully everyone has a primary care doctor under their insurance, and you can call their office and ask them some of your coronavirus testing questions specific to you. But know that when you go in, if they decide that you need to have the test done and you go in to have the test done, that should be provided to you at no cost. And if you're charged for it, you should try and dispute that with the health insurance company. Many health insurance companies currently are not charging for the COVID-19 treatment. That's dependent on the company though. And they have been sending emails and communications to people who are enrolled under their health insurance plans. And so it's really important to kind of stay on top of that and see what your individual health insurance company is doing. And there are so many, it's really, really difficult to stay on top of. The state-run insurances, so things like Medicare and Medicaid, and let's see, I think CHIP and some of the plans that are under Marketplace, they have been offering testing and treatment at no cost. The states have been putting out information about that. So you want to pay attention to a couple of different things there. But the best thing that you can do is stay on top of where, with your health insurance company, what are they saying about treatment for coronavirus. So we have a question here about, I've heard you can get an antibody test at LabCorp for $10. I don't know anything about that. I would say that from what I've read so far, the antibody tests can be difficult to interpret, and maybe they aren't as reliable as maybe we'd like them to be. So I would say be a little bit wary of that. And some of the antibody testing has been free under the same legislation that made the coronavirus testing free, but it's really challenging because it's kind of a mixed landscape when it comes to regulating these tests and how well they're working right now. So I would, if you're concerned about it, I would reach out to your doctor and see what it is that they'd like you to do. If you have concerns about needing those kinds of tests. Okay, so it's really important to keep in mind that apart from the free testing policies are pretty inconsistent, and they might depend on your state and your health insurance company. So unfortunately, other than that you should not get a bill for the testing, I can't make a whole lot of really sweeping statements about what should or shouldn't be true for you in your particular situation, just because the different states and health insurance companies have been so different in the way that they've decided to handle this. I am going to share some resources with you in a little bit, some links where you can see what are the policies that are going on in your state. And you might be also able to look up your health insurance company and see if they've made any statements about what they're doing as far as charging for the coronavirus testing or a treatment. So I'll share those in a little bit. Okay, so how can you estimate how much you might pay? Remember that the COVID-19 testing should be free. If you got a bill, you would want to dispute that. For doctor visits, you really want to know your copay amounts and your coverage levels. So if you look at your insurance card, it usually lists some numbers there. One of them is going to say like PCP or primary care, and then specialist, and then ER. Those are how much money you'll pay when you go in to be seen. If you end up having to see a specialist or go into the emergency room. So that's a good one that you can kind of know. That's what you'll be asked to pay, like kind of right when you walk in the door before they even let you anywhere else. Those numbers should be listed on your card. Your copay levels might be listed on your card too. Sometimes it'll say in-network 80-20 or 70-30, which means that your insurance company is going to pick up 70% and you're going to pick up 30% or something along those lines, depending on your individual coverage levels. But keep in mind that that's also going to be dependent on whether or not you've met your deductible, which is just like car insurance. It's that amount that you've got to pay before they start paying for things. Okay, and again, all that information for your own specific policy, you can get that by looking at your evidence of coverage, or if you don't have that document, you're not sure where you put that one down, you can call your health insurance company too. There should be a number listed on your card. You can call them and get some information. Okay, for treatment, it's really hard to estimate. Hospitals and doctors' offices often set their own prices for things, and they're not the same prices across the board. So it's really difficult to say how much someone might spend if they have to be, say, admitted to the hospital and treated in that way. It's really challenging to know. But the best thing that you can do is just try and follow your doctor and your any of their recommendations that they make. So if you are concerned and you call the doctor's office and they say you need to go to the hospital, and you need to go to the hospital. We like to try and do as much as we can early with preventing, try and stay in network and some of these kinds of things. But the bottom line is that the healthcare services that are out there are there to help you to stay well and to make sure, nothing really terrible happens. So we want to do this as much as is reasonable and as possible. But if you are concerned that there's an emergency happening, the bottom line is you got to get to the emergency room. So I would just want to make sure I'm stating that really clearly. If you're unsure, you can, maybe call the doctor's office, your primary care office, or call urgent care. Sometimes you can call your doctor's office and speak to a nurse, and they can kind of give you a suggestion as far as where they might want you to go. So you do have some options, but I really want to stress that if you're in a situation where you think it's an emergency, you should go to the emergency room. All right. Some important tools for everybody. These are hyperlinked here. What I'm going to do is put links in the chat. I can pull them up. I'm going to have to do that in just a little bit when I get to the end of this. So I have some tools that we share. We have a website with extension I'm going to share the link to in just a little bit. The first one is helping make a good guess for out-of-pocket expenses. This is, the document's just a couple of pages, but it takes you through helping you figure out what your individual costs are. So it helps you figure out what are your co-insurance amounts, what are your copay amounts, how much would you maybe be spending in the course of a year over healthcare expenses. The next one is one called Understanding and Estimating Healthcare Expenses. It's similar to the helping you make a good guess for out-of-pocket expenses, but it goes a little bit more in depth. And the last one is important words to know. So I know I've talked about a lot of different things here: deductible, in-network, out-of-network. And so I'm going to share a link to that when we get to the end so that you guys can pull up this document, and hopefully what it can do for you is help you understand some of those terms that are really specific to health insurance in a less confusing way. Because sometimes it can be really, really difficult to figure out what you're reading when you're looking at some of the things that come from your health insurance company. All right, so I will get everybody those resources. It'll take me just a second. And I want to review just a few tips when it comes to managing healthcare costs. It's really important to know your health insurance documents, know your plan and the costs associated with it, as much as you can, to estimate things like co-payments and prescriptions, equipment, and things like that. Especially with some of the things like healthcare savings accounts or flexible savings accounts, you can calculate how much you might need in a year in health insurance and set that aside in an HSA or an FSA so that you can have that money kind of saved to be able to spend on those healthcare expenses. And then at the end of each year, it's never a bad idea to shop around for your health insurance plan, especially if things with your health status have changed. You might want to check and make sure that your health insurance plan covers a new doctor that you might need to see, or new medical equipment that you might require. So checking out your plan options when it becomes open enrollment can be a really great way to make sure that you're getting the plan that really covers what you need. Health insurance plans can be really, really specific sometimes about what they're covering and what they won't. Sometimes it can be cheaper in the long run to maybe pick a more expensive plan because it's going to cover a service that you really need at a higher level. And if that's a little bit confusing, like I said, we have some other webinars coming up and we can take people through it a little bit more in depth, comparing those different plans and understanding how one, although it might be more expensive in premiums, might help you cover healthcare expenses easier, or one that might be less expensive in premiums, that you can set aside money to save for what you need rather than pay for the more expensive plan. Hopefully that makes sense. All right. So just a reminder about the stuff that we've gone over in the specific COVID-19 programs. Testing should be free. So in some places you have to have an order from your doctor to get the test. In some places you can just walk up and get the test done. They may still ask to see your insurance card so they can bill your insurance. In some places maybe they won't, but it's partially because it's a little bit patchwork how everybody's doing it. But the bottom line is that testing should be free to you. There's a special enrollment period. So if you lose your job, you have that special enrollment period to find new insurance. Also in the state of Maryland until June 15th, there is also special enrollment regardless. So even if you lost your job more than 60 days ago, or if you were uninsured for some reason this year, you can get insurance up until June 15th, unless that Maryland decides to extend that deadline. There's a special enrollment period just for the COVID-19 situation that goes until at least then. Some states have expanded sick leave, and so you might be more able to get off of work to go and get the coronavirus test if you need to. The waiving of cost sharing. So this is what we went over with that certain states or health insurance companies have said that their people who they insure are not going to have to pay anything to be treated for coronavirus. So that cost sharing is for treatment. So the testing is the part that's free, and the treatment part, it's going to depend on your health insurance plan and on your state. And as I said, I'm going to share some resources for that. Okay. So my really key points that I want to make sure I'm really driving home here today are to get covered by health insurance and stay covered. It's really important right now to stay on top of your health insurance. Make sure you have it. Make sure you know how it works. If you lose your job for some reason, or if you lose your coverage for some reason, make sure you find new coverage right away so that you're not ending up in a position where you don't have health insurance and you need to pay for treatment for the coronavirus. use your health insurance benefits. We're actually gonna, in a couple of weeks, we're gonna have another webinar just focusing on making sure that we're still using our health insurance, even though things are a little bit up in the air right now. So stay in touch with your doctor's office. If you need regular testing for a chronic health condition, talk to your doctor's office and figure out if there's a safe way for that to continue. If you have kids, talk to your doctor's office and make sure that you're getting them any checkups and things that they need. You really want to stay on top of this stuff so that it doesn't become an emergency later. So you're paying for that health insurance. You want to make sure that you're using it now so that you don't end up in a situation where you've got more to pay for later. Know your plan as much as you can. It'll really help you reduce costs. I know some of the time those evidence of coverage documents can be really long, but sometimes they will provide you with a shorter document to go along with it that kind of hits the highlights and explains things. So do your best to read through that stuff. It may not be fun, it may not be exciting, but try and see if you can pay attention to it so you know what's going to be covered. And really pay attention to communications from your insurance company, from local healthcare providers, government organizations. As I said, the process of kind of rolling out how we're going to deal with this whole situation has really depended on the state. It's dependent on the health insurance company. It's going to be different for different people. And so pay attention to what's going on with your health insurance company. Maybe sign up for their kind of email list so that you can get updates if they're making changes to the way that they are covering things. One of the major things that health insurance companies have done is expanded all the things that they are willing to pay for if you get them done via the internet. So it used to be that companies didn't want to cover too much that was telehealth, but they're willing to cover a lot more of it now. So staying on top of those kind of things can help you figure out if you've got expanded options under your health insurance coverage. Paying attention to, government organizations. Some of the communication about the coronavirus policy has come from the CDC. Some of it has come, through different channels. So staying on top of that and trying to make sure that if you read a headline that says something crazy, you go and find the written proclamation or, something from a government organization that states exactly what it is, because there has been confusion sometimes when different policies get rolled out. So we want to stay on top of that communication as much as we can. Okay, so we have gotten to the questions point of today. I am going to wait and see if we have any questions that come in. I'm also going to stop sharing my screen for just a second so that I can pull up some of the links that I mentioned to you. All right. The link for the resources that I mentioned is in the chat now. That's where you can find some of the tools that I mentioned that'll help you with some of the estimating costs and those kinds of things. I'm also going to pull up. There is a link that I'm putting into the chat that can help you. It's an alphabetical lookup of health insurance companies and the communications that they've released about their coronavirus policies. So it's a point where everybody's kind of collecting together. Here's what Aetna has said about their policy. Here's what Anthem has said. Here's what Blue Cross Blue Shield of Arkansas has said. So those different things that those companies have put out are listed in that link there as much as they could. So sometimes it's hard to find all that information and pull it together. I'm also going to post the link to how you can figure out how you find insurance for yourself. So I mentioned that some states have their own marketplace. Some states participate in the federal marketplace at healthcare.gov. So that healthcare.gov link will help you figure out, are you a Marylander who needs to go to Maryland Healthcare Connection? Are you, someone from, I think, Delaware goes through the main healthcare.gov site. So you'll want to check that out. And so if you need to sign up for new coverage, you can use that link to figure out where you specifically go to find that coverage that you need. Okay, so I'm going to switch back here. My contact information is here. If you have a question, if you want to ask me for more links or more information, my email is listed there. I'll give it just a second. I haven't seen any questions that have come in through the chat so far. Courtney, I don't know if there are any that you have seen.
No questions through Facebook, so I think we're all good.
All right. Well, hopefully this has been helpful for everyone. Hopefully I've answered some of the questions that you might have had about health insurance and how it relates to the coronavirus situation. I really want to thank everyone for participating today, for taking a half an hour out of your day to join me and to go through all of this. I know health insurance isn't everyone's favorite subject, but it's really important, and it can help us make sure that we stay healthy and avoid some of the really high costs that can come with healthcare. So hopefully this was helpful for you all. And I will be around for just a second, just a few minutes in case any other questions come in. But otherwise, I am gonna say, have a great rest of your day. Hopefully the weather is nice where you are. Enjoy it. And thank you for coming.
Thanks so much, Carrie. We appreciate it.
Yep, absolutely.